Romidepsin solution, Reconstituted, Recon Soln, is a medication used to treat a specific type of cancer called cutaneous T-cell lymphoma. It works by stopping the growth of cancer cells. The dosage and timing of taking this medication will depend on your specific medical condition and response to treatment. It's important to follow your doctor's instructions and take it at the same time each day. Before starting your Romidepsin treatment, make sure to read the patient information leaflet provided by your pharmacist. This medication is given through an injection into a vein by a healthcare professional, and it is important to follow your doctor's instructions. Typically, it is administered over 4 hours on days 1, 8, and 15 of a 28-day treatment cycle, which may be repeated as directed by your doctor. The dosage of Romidepsin is determined based on your medical condition, body size, and how you respond to the treatment. It is important to receive this medication regularly to experience the most benefit from it. You can mark your calendar to remind yourself when to receive the next dose. If you experience nausea, vomiting, tiredness, or loss of appetite, it's important to let your doctor or pharmacist know. This medication can cause serious side effects, but your doctor has prescribed it because they believe that the benefits outweigh the risks. It's important to be closely monitored by your doctor to minimize these risks. Romidepsin can decrease bone marrow function, leading to a low number of blood cells and potential effects such as anemia, decreased ability to fight infections, or easy bruising and bleeding. If you experience symptoms such as unusual tiredness, pale skin, signs of infection, or easy bruising/bleeding, it's important to contact your doctor right away. Additionally, seek medical help if you experience very serious side effects such as chest pain, fast/irregular heartbeat, severe dizziness, or fainting. In some cases, Romidepsin can cause side effects due to the rapid destruction of cancer cells. Your doctor may prescribe additional medication and instruct you to drink plenty of fluids to lower your risk. If you experience symptoms such as low back/side pain, signs of kidney problems, or muscle spasms/weakness, it's important to inform your doctor immediately. While rare, a serious allergic reaction to this drug can occur. If you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help right away. It's important to note that this is not a complete list of possible side effects. If you experience any other effects, it's important to contact your doctor or pharmacist. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before taking this medication, make sure to inform your doctor or pharmacist about any allergies you may have. This medication may contain inactive ingredients that could cause allergic reactions or other issues. It is important to share your medical history with your doctor or pharmacist, especially if you have liver disease, heart disease, or any current or recent infections. Romidepsin may affect the rhythm of your heart, causing serious symptoms that require immediate medical attention. The risk of this condition may be increased if you have certain medical conditions or are taking other drugs that can also affect your heart rhythm. Low levels of potassium or magnesium in your blood can also increase the risk of heart rhythm issues. It is important to discuss this with your doctor, particularly if you are taking certain medications or have conditions that may lead to low potassium or magnesium levels. Before undergoing any surgical procedures, be sure to inform your doctor or dentist about all the medications and products you are using. Romidepsin may increase your risk of getting infections or worsen existing infections. It is important to avoid contact with people who have contagious infections and to discuss any potential exposures with your doctor. Make sure to inform your healthcare professional if you are using Romidepsin before receiving any immunizations or vaccinations. It is also important to avoid contact with individuals who have recently received live vaccines. To reduce the risk of injury, use caution with sharp objects and avoid activities that may lead to physical injury. If you are an older adult, you may be more sensitive to the side effects of this medication, particularly heart rhythm issues. If you are pregnant or planning to become pregnant, you should not use Romidepsin. It may harm an unborn baby, and reliable forms of birth control should be discussed with your doctor. If you or your partner becomes pregnant, it is important to speak with your doctor about the risks and benefits of this medication. It is unknown if this medication passes into breast milk, so it is not recommended to breastfeed while using Romidepsin. Be sure to consult with your doctor before breastfeeding. It's important to be aware of potential interactions with other medications when using Romidepsin solution. This includes drugs like disulfiram and blood thinners such as warfarin. Additionally, certain medications can affect how Romidepsin is removed from your body, potentially impacting its effectiveness. These drugs include azole antifungals, dexamethasone, macrolide antibiotics, nifazodone, rifamycins, St. John's wort, and some drugs used to treat seizures. It's also crucial to note that Romidepsin solution may decrease the effectiveness of hormonal birth control such as pills, patch, or ring, potentially leading to pregnancy. It's recommended to discuss with your doctor or pharmacist whether additional reliable birth control methods should be used while taking this medication and for 1 month after stopping treatment. Additionally, any new spotting or breakthrough bleeding should be reported to your doctor, as these may be signs that your birth control is not working effectively. If someone has taken too much Romidepsin solution and is experiencing severe symptoms like losing consciousness or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call 911 or your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. It's important to have regular lab and medical tests, such as complete blood count, potassium/magnesium blood levels, EKG, liver function, while using Romidepsin solution, Reconstituted, Recon Soln. Make sure to keep all medical and lab appointments to monitor your health. Make sure to take each dose of Romidepsin solution, Reconstituted, Recon Soln, as directed by your doctor. If you happen to miss a dose, be sure to consult with your doctor or pharmacist to establish a new dosing schedule. This medication, Romidepsin solution, Reconstituted, Recon Soln, is typically given in a hospital or clinic setting and is not meant to be stored at home. It is used to treat a certain type of cancer called cutaneous T-cell lymphoma, CTCL, in patients who have received at least one prior systemic therapy. The dosage and timing of administration will be determined by a healthcare professional based on the individual's specific condition and needs. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.